Pnawn da, Eluned Morgan dwi, Gweinidog Iechyd a Gwasanaethau Cymdeithasol yn Llywodraeth Cymru. A heddiw, yn ymuno gyda mi mae Dr Gill Richardson, Dirprwy Brif Swyddog ein rhaglen brechu Covid-19. Heddi, i ni'n cyhoeddi diweddariad ein strategaeth frechu. Mae'n nodi ein cynlluniau ac amserlen ar gyfer y rhaglen dros y misoedd nesaf. Fe awn ni drwy rai o'r cynlluniau hyn gyda chi, ond fydwch ni hefyd ar gyfnod yr hydref a'r gaeaf a sut allwn ni gyd gadw'n iach. Today we're publishing an updated version of our vaccine strategy, which sets out our plans and timescales for the programme in coming months. We'll talk you through some of these plans, but also look ahead to the autumn and the winter and look at how we can all stay well. Now, as the First Minister said on Friday, vaccination continues to be our best defence against coronavirus, especially as we face a second pandemic winter. I'm going to ask Gill to talk you through what our vaccination programme has already achieved and what's coming next. But first, I want to say a few words about the anti-vax protests we saw at one of our vaccination centres this weekend. We all have the right to take part in peaceful protests and to make our views known. But reports of adults bullying and harassing children and their parents as they enter a vaccination clinic are nothing short of despicable. I'm going to hand over to Gill now, who's going to talk you through the updated vaccine strategy.
Thank you, Minister. It's been just over 10 months now since we started the vaccination programme in Wales. And in that short time, the NHS has given more than 4.7 million doses of the 3 main COVID vaccines. People in Wales have embraced the vaccination programme and we've had very high take-up rates. More than 87% of people aged 12 and over have had their first dose, and more than 81% have had 2 doses. That is an incredible achievement, and it's thanks to the hard work of everyone involved in this very complex programme, from all those that are planning the delivery and the logistics behind the scenes to everyone working in clinics across Wales. If anything, the programme has become more complex as it's progressed, and we're currently running what in normal times might be considered to be 4 distinct programmes. We're in the process of giving younger adults their second doses, but we're still seeing some people from older age groups and priority groups coming forward to have their first vaccines. I'd like to remind people that it's never too late to come and have your vaccine. Our doors are open and there are more details on our website and on the Health Board's websites about how to get a vaccine if you've considered and now wish to have this. We're prioritising everyone who's severely immunosuppressed for an urgent appointment at a time that's right for them. The exact timing of their appointment for their 3rd primary dose is tailored to their treatment and is based on advice from their clinician. We're vaccinating 12 to 15-year-olds and providing the autumn booster programme. Our updated vaccine strategy sets the ambitious target that by the 1st of November, all 12 to 15-year-olds will have been invited to have their vaccine and all eligible care home residents will have been offered their booster. As the booster vaccine has to be offered at least 6 months after the second dose, we expect that we'll be able to offer the majority of people in priority groups 1 to 9 an appointment by the end of the year. Before I hand back to the Minister, I want to recognise the thousands of people who have volunteered to test these vaccines and the role that they have played in the success. We are incredibly grateful to everybody who took part in vaccine clinical trials in Wales. The development of these COVID vaccines is an incredible example of international collaborative research, and a great many Welsh people volunteered to test them before they were approved for use. Their support has been invaluable. From this week, all eligible trial participants will be offered an option of an additional vaccine course if they are travelling to a country which does not recognise trial vaccines. And arrangements are in place to ensure all eligible trial participants can receive an autumn booster. Letters have been sent to the trial investigators and to all Welsh participants to set these arrangements out in more detail. Minister.
Diolch yn fawr, Gill. Mae cyfraddau coronavirus wedi parhau I ostwng ar draws Cymru sy'n bositif iawn. Mae'n rhoi hyder I ni fod brig y Don Delta wedi pasio. Ond, mae achosion yn dal I fod yn uchel ar draws Cymru. We've continued to see falls in the rates of coronavirus across Wales, which is really positive and suggests we've passed the peak of the Delta wave. But causes remain very high across Wales. It's important we do everything we can to control the spread of the virus in our communities and prevent new infections. We're facing potentially a tough winter ahead of us. Although we're seeing cases of coronavirus coming down, it's clear that the pandemic won't be over by Christmas. And we have to take seriously the impact of other seasonal winter viruses, such as flu and respiratory syncytial virus, or RSV, which causes an increase in serious illness and puts pressure on our health and care services. Modelling shared with the Joint Committee for Vaccination and Immunisation has suggested this winter flu season could be 50 to 100% higher than a typical season and could peak at a different time. This is the first season where we'll have significant amounts of coronavirus circulating as well as flu. We saw very little flu last winter. You remember that we had lockdown restrictions in place because we were dealing with really high levels of coronavirus caused by the Alpha or the Kent variant. Now, data from our health service suggests the RSV season started earlier than usual this year in Wales in July. Young children are particularly vulnerable because they will not previously have been exposed to RSV. Felly, sut allwn ni gadw'n ddiogel ac yn iach dros y gaeaf? Y newyddion da yw nad ydy'r ffliw na'r RSV yn broblemau iechyd newydd. Mae gyda ni gynlluniau dibynadwy ar gyfer y ffliw I ddelio gyda niferoedd mawr o achosion. I ni'n barod am y gaeaf. So how do we stay well and safe this winter? The good news is that flu and RSV are not new health problems. We've tried and tested flu plans in place to help deal with large outbreaks, so we are prepared for winter. We'll be publishing our winter plan next week, which will set out the local and national measures the NHS, social care, regional partnership boards and other partners will take to manage demands on essential services through the next 4 to 6 months. And just as vaccination is our best defence against coronavirus, it's also our best defence against flu. This year's NHS flu jab campaign is underway already. The free vaccine is available to children under 15, people aged 16 to 50 in an at-risk group, pregnant women, people over 50, people living in care homes, carers, close contacts of immune-compromised individuals, and frontline health and social care staff. Having a flu jab is really important for people who are older, pregnant, or those who have a health condition and are more vulnerable to complications as a result of the infections. It's really important frontline health workers and those working in care homes or providing care in people's homes get their flu jab to help reduce spread. But the simple steps we've all been taking over the past 18 months to control the spread of coronavirus will also help us to beat the battle of bugs this winter. If we keep doing things that keep us safe from coronavirus, such as washing our hands regularly, keeping our distance, wearing a face covering in indoor public places, working from home wherever possible, meeting people outdoors if possible, and keeping indoor spaces ventilated, we can also help to keep ourselves safe this winter from other nasty illnesses like flu and RSV. Diolch yn fawr iawn I chi, and I'm now willing to take questions from journalists. Cwestiwn cyntaf, oddiwr Dan Davies, BBC Wales.
Diolch, Gweinidog. Dyma ddau gwestiwn I chi, a byddwn ni'n diolchgar am atebion yn Gymraeg a Saesneg os gwelwch yn. In today's report from 2 House of Commons committees, it said that the late lockdown in last March was not a mistake, it was a deliberate policy proposed by official scientific advisors and adopted by the governments of all the nations of the United Kingdom. That was clearly wrong, it says, and ranks as one of the most important public health failures the UK has ever experienced. Was anyone in the Welsh Government, in cabinet meetings or anywhere else, putting their hand up at the time and saying we need to act sooner to stop the virus spreading? And if not, why not?
Well, you'll be aware that this particular report is about 147 pages long. It predominantly refers to the situation in England. Of course, it would have been extremely difficult for us to lock down before England for lots of practical reasons, because, for example, we've got the border, but also because furlough was not available. So it would have been difficult for us to have that gone any time sooner. The fact is that we have responded, I think, very positively since then. Our vaccination programme has been highly successful. We know that that has helped to avert around 7,000 deaths and 10,000 hospital admissions. So since then, I think what you will have understood is that we have taken a far more cautious approach compared to that of the rest of the United Kingdom, but also that I understand the report talks about the dangers of centralisation, and what we've done is to try and empower local communities and local authorities to make sure that they have really taken advantage of the opportunities that they have to know their local communities, and that's why our TTP system has been not just more successful but also a lot cheaper.
Allech chi ateb hwnna'n gyfar, os gwelwch yn dda?
Diolch yn fawr. Chi'n ymwybodol bod yr adroddiad sydd yn cyflwyno tua 147 o dudalennau yn ymwneud y rhan fwyaf gyda Lloegr a'r sefyllfa'n Lloegr. Fe fydda hi wedi bod yn anodd dros ben i ni i roi clo ar ein cymdeithas yn gynharach na Lloegr am resymau ymarferol, fel y ffaith bod dim furlough ar gael, fel y ffaith bod y ffin mor agored rhyngddo ni a Lloegr. Ers hynny, i ni wedi bod yn ymateb mewn ffordd sy'n lot fwy cautious, wedi sicrhau ein bod ni'n cymryd camau sydd yn deall bod angen i ni ymateb yn lleol lle mae hwn yn bosibl. Felly'n wahanol iawn i rhai o'r pethau sydd yn cael eu cydnabod yn yr adroddiad.
The report also says that it was a serious mistake to stop community testing early last March, and the Welsh Government did that as well in the middle of that month. Why was testing stopped at that point?
Well, I think you'll be aware that there were limitations on the number of tests that were available at that point, and that was part of the reason that we were not in a position to extend testing. Of course, had we been in a different situation, we would have continued that testing, but that was not the situation that we had in front of us at the time. Yn amlwg ar y pryd, oedd yna broblem o ran niferoedd a'r cyfleoedd oedd ar gael i brofi pobl oedd gyda coronavirus, a dyna rhan o'r resymau pam oedd rhaid camu yn ôl o'r profi oedd yn cael ei wneud tu fewn yn cymdeithas ni. Wrth gwrs, pe bydden ni wedi bod mewn sefyllfa lle oedd na fwy o brofion, fe fydden ni wedi gallu cario ymlaen gyda'r sefyllfa yna. Can I ask Rob Osborne, ITV Wales, please?
Thank you, Minister. Following on from Dan's questions, what people in Wales won't have heard this morning is an acknowledgement that mistakes were made in the early days of the pandemic in Wales. Minister, did Groupthink contribute to Welsh deaths?
I was a member of the Cabinet at the time, and I can tell you that there were always very robust discussions in relation to COVID. I'm very clear also that we were very focused on the public health situation, and I think that we've got to be aware that maybe there was a slight difference in emphasis that was coming from England, very much more focused perhaps on the economic aspects of what coronavirus might mean. So I don't agree that there was a groupthink approach in Wales. Our discussions in Cabinet are always open, robust and respectful, and that is something that the First Minister has encouraged throughout the pandemic.
And moving on to another issue of COVID passes, they're in nightclubs, they're in the places that you've asked them to be in now. What about extending them to other places, the workplace, care homes, other such venues?
Well, at the moment, we're obviously focused on making sure that the system works as well as it can in relation to discos. You call them nightclubs now, don't you? To nightclubs and all kinds of other settings that we've set out. But, of course, the First Minister has suggested that there may be a point at which we would be asking for COVID passes to be introduced in care homes and maybe even hospitals. But we're not at that point yet, but this is something that which we will obviously keep under review. Mark Smith, Wales Online. Oh, no, it's not. It's Dan Bevan, sorry.
Thank you, Minister. Good afternoon, and to yourself as well, Dr. Richardson. If I could turn attention back to the report, if you don't mind. UK Government Minister Stephen Barclay on LBC this morning refused 8 times to apologise for the failings early on in the pandemic. Now, obviously acknowledged that this was looking into the UK Government, not the Welsh Government, but many of the criticisms, we've already mentioned a few of them already, can be levelled at yourselves. Locking down earlier case numbers, in hospitals then being moved into care homes, and of course community testing. Minister, will you apologise for the failings early on in the pandemic?
I've never really understood why politicians have such a problem in apologising. And so, yes, of course, I'm prepared to apologise to all of those who've suffered during the pandemic. This was a new disease that we'd never seen before. None of us knew how it was going to impact. None of us knew how it was going to spread. None of us had any idea of the fact that it could be spread even without showing any symptoms. So, of course, we had a huge amount to learn, and I'm pleased to say that we have learned over the course of the pandemic. And of course, we made some mistakes at the beginning of that process because of the lack of information and data and knowledge that we have, that we now have learned. And of course, I think we have a duty and responsibility to say sorry to people where we've made mistakes.
And is this report not the best evidence so far that Wales is in need of an independent COVID inquiry looking into exactly how the Welsh Government handled the early parts of the pandemic?
Well, I think this report does predominantly look at the English experience, but the very fact that you're asking questions to me about an English report in Wales suggests to me that there is an interconnection between us. It is not a template, I hope, for what we are hoping to see in relation to a public inquiry. You'll be aware that the First Minister has already written to Michael Gove to ask for some very clear guidelines and stipulations in relation to what that should cover. Until we have a response from that, I think it's appropriate for us to work on the assumption that they will be positive in their response to those requests by the First Minister. But of course, we will continue to keep this under review. Right, Mark Smith, Wales Online.
Thank you very much indeed. This is a question that I'm sure either of you could answer. Around a quarter of 12 to 15-year-olds in Wales have now had a dose of the coronavirus vaccine. Despite this encouraging start, have either of you been made aware of any incidents of parents not giving their consent for their children to have the vaccine? Have clinicians, for instance, reported having to use the capacity and competence test on children who do wish to be jabbed?
Gill.
Okay. So we have circulated, obviously, to all our health boards, the Gill competence guidance, and the Green Book is very clear on this. So all health professionals would be looking to have those conversations, and where there are differences of opinion, then they would be looking to input into those decisions. But ultimately, as you say, if a young person has competence, they are able to make the decision to have the vaccine. We are not receiving reports of numbers of people having this problem. Obviously, our health boards are monitoring the situation closely in their clinics, so they would be gathering if there were any cases, but none that have come to us thus far.
Thank you very much indeed. And secondly, this is a question for the Health Minister. Members of both Unison and the Royal College of Nursing have recently turned down the Welsh Government's offer of a 3% pay rise for NHS workers. Should urgent talks with the government fail to boost the awards, Unison says that a ballot for industrial action will be triggered. So will the Welsh Government be able to offer more than 3%? And if not, how concerned are you about strike action taking place and its potential impact on NHS services?
We act in social partnership here in Wales, and we've had continuous discussions with representatives from trade unions, from health services. Of course, we have tried to see what more we can give. I think it's absolutely clear, and it's important that it is made clear that it is extremely difficult. No, it's impossible for us to find more money without getting that money from the UK government. And let's just make clear that the 3% that we have found has been found from our budget that could otherwise have been spent on other aspects of health and care. If we need to find any more, we would have to make substantial cuts into some significant areas at a time when 20% of our population are waiting for operations. So we would love to be able to give more, but I'm afraid until the UK Tory government opens their checkbook, it's going to be very difficult. Now, in the meantime, we are looking at whether there are any other issues that we can help with, and those negotiations are continuing. Can I move now to Alan Evans, Llanelli Online?
Good afternoon, Minister and Dr. Richardson. Carmarthenshire Statutory Director of Social Services, Jake Morgan, has described the impact of national social care pressures locally as impacting significantly in areas of mental health, childcare, children in care and care homes. The report also highlights the need for a long-term funding settlement from Welsh Government to transform the way in which social care is delivered. Councillor Jane Tremlett, the Cabinet Member for Health and Social Care, said, "We're doing everything possible to support those who need our help, whilst also supporting the workforce who are doing such a wonderful job under such great pressure." Is the Welsh Government ready and able to step in to do everything possible and address this significant problem for Carmarthenshire County Council and the residents they serve?
Well, thanks very much. And I'm very aware that this is not a problem just for Carmarthenshire, but it is a problem that is a real struggle for local authorities across the whole of Wales. The situation in relation to care remains one that is very fragile indeed, and that's why we are meeting on a weekly basis with representatives from local authorities and health boards to see what we can do to ease the pressures this coming winter. We've already given £48 million to local authorities to help them throughout this time. We've undertaken a massive recruitment campaign, and we will be undertaking a further recruitment campaign in future weeks. We've also are building up measures where we can give more support for carers and the voluntary sector. But of course, you'll be aware that we also have a longer term commitment that we are determined to undertake, and that is to make sure that we pay the living wage for people who do a really tough job. And it's a job that I think commands respect and that is also very rewarding. And so if people are interested in joining the care workforce, we would encourage them to do that. We do also recognise that there is a need for radical reform in relation to care when it comes to the future. We have an ageing population, and we are taking a fresh look at this at the moment, but obviously we need to do that when we understand what the financial envelope will be from the UK government.
Yesterday, I got a call from the head of my child's school to inform me that my child had been in close contact with somebody who had tested positive for COVID-19. The head told me that usually Track and Trace would be making these calls, but they were too busy. Given the importance of our children's education in Wales struggling to attain the same sort of PISA results as our counterparts in many countries across Europe, is the Minister confident that enough resources are available for the Test, Track and Trace service across Wales in order to avoid valuable teaching time being wasted in making hundreds of calls to parents?
Well, we've always been clear that we are determined to try and keep our children in school. They've missed enough schooling already, and that could have an impact on their their long-term ability to keep up. And therefore, we are determined to try and keep those schools open. And that's why we're extending the vaccination programme to 12 to 15-year-olds and making sure, and you'll have seen there was an update last week in terms of the guidance around lateral flow testing, which should be undertaken on a daily basis for those who have a sibling perhaps who is COVID positive, and they shouldn't be going to school unless they have taken that lateral flow test on a daily basis. The pressure on the test, trace and protect system at the moment is immense. We have incredibly high levels within our communities at the moment. We have around 2,000 people working in test, trace and protect, and in 1 week, for example, in September, they managed to trace around 15,000 index cases and 25,000 close contacts. So already, of course, the system is under strain, and we're entering winter. And so I do hope that people will bear with us during this period. But of course, that is quite a significant resource that is already being put into this. Can I ask Harry Hansen for a question?
Thank you. I wanted to ask the Minister about COVID passes. Of course, they've been introduced in places like nightclubs. With so many children being off school and the vaccination programme being extended to 12 to 15-year-olds, do you think that COVID passes are something which is likely to be extended into schools and places, like workplaces, to combat COVID?
I wouldn't foresee a situation where we would extend COVID passes into school. No, we've made it absolutely clear that getting a vaccination in school is a voluntary system. Of course, people are able to have lateral flow tests, but children should be testing themselves twice a week as it is. So I'd be very reluctant to see that being extended to our schools. We've made it absolutely clear that a nightclub is something that you don't have to go to. A school is something that you really should.
Great. And another thing as well, sorry, just that. Is there a kind of support programme plan to support businesses who are claiming that COVID passes are having a negative impact on their business?
I don't really understand what the huge additional expense would be for these the nightclub owners and the bit large event owners. Clearly, they should be checking people for whether they are the right age to enter into these clubs already. So I don't think it's a big deal to extend that to checking whether their passes are valid. So at the moment, that's not something that we are undertaking. But of course, we have given significant support to some of these, in particular in hospitality, over the summer months. So there has been massive support for that sector. Great, diolch yn fawr i chi gyd.